Then we have the other common symptom that we see and will make women worried is that they don't get regular periods. And their periods are prolonged.
Oh, yes.
They stay for like 3 months, 4 months, 6 months, and they don't get their periods.
Yes.
So they get worried and they come to us.
Yeah. Hamujambo, tumewafikia tena kaskazini, magharibi, mashariki na kusini. Kokote ulipo, tunakufikia. Ni mimi wenu Faith Ngami na tupo studio tena na daktari yupo tayari kuwajibu. Maswali yenu atawajibu. Kwa wale mliomtembelea, tunawashukuru sana. Kwa wale mnaopanga kumtembelea, daktari yapatikana. Kokote alipo, atawafikia. Daktari, karibu sana.
Asante sana Faith. Dr. Karanja hapa. Kama kawa, kama dawa, your gynecologist wa kila siku, niko tayari kuwajibu maswali. Thank you so much.
Daktari, kabla hatujapoteza wakati, manake maswali yamemiminika.
Ni mengi.
Yes. Wateja pia wanauliza. Kuna wengine wanataka ufike pale utawafikia. Sijui utawafikia?
Kufika tunaweza fika. Hata kama ni Nairobi.
Nairobi utafika?
Utafika.
Manake wanatamani sana, wanasema daktari yuko wapi? Naambia ako Mombasa, lakini Nairobi,
yes.
Safari itabidi tupange pia.
Tutapanga tuende Nairobi.
Sawa sawa.
Na Tanzania, naona kuna mafanzi wa Tanzania pia.
Tutafika. Daktari amewapata na atafika.
Okay.
Tungependa kuanza na the Polycystic Ovary Syndrome, meaning PCOS.
Yes.
Because people are going through PCOS.
A lot.
And they would love to know, so that by the time they are visiting their gyno and they're asking their gyno, they also have an idea of what exactly are they asking their gyno.
Okay.
Yes.
PCOS is quite common, and it's more common than we think is. And PCOS just means Polycystic Ovary Syndrome.
Yeah.
And the syndrome means it's a disease with many symptoms.
That's true.
So for Polycystic Ovary Syndrome, it's mainly a hormonal problem that leads to one of the signs that we see is that the ovary has many eggs. Usually when you look at the ovary using a scan, you'll see like 3 to 5 eggs.
Okay.
So you see many eggs on the periphery. Then you see in women, the androgen levels are usually low. So when you come to PCOS, you'll find that the androgen levels are slightly high for women. So the hormonal problem is mainly, and by androgens I mean testosterone, that is the male hormone.
Yeah.
Now the other problem that happens with PCOS is that the insulin levels might be high because of insulin resistance. So you'll find problem of insulin, problem of androgen levels leads to other symptoms, and the most common ones in reproductive health. They miss their periods for like 2 to 3 months.
Okay.
Some of them even for 6 months.
Oh, yes.
The other symptom is that you find a lady with a lot of facial hair. And sometimes they have a male pattern hair. They have hair on the chest. There's also acne. They have a lot of pimples on the face because the androgen levels are high.
Yeah.
So there are many ways of treating PCOS, which I believe we will discuss.
Oh, yeah, that's true. Thank you for introducing PCOS, because it was actually, I needed to also get the introduction of it well.
Yes.
So even proceeding now to how does it occur? Is it something, is it genetic? Is it a lifestyle disease? How does it come up?
We don't know the cause of PCOS so far, but we have theories that try to explain why PCOS occurs.
Okay.
One of them is genetic, as you've said. You'll find most commonly maybe the mother or the aunties or the sisters of the person who is affected also have PCOS.
Okay.
And the other factors is, as I've said, hormonal.
Yes.
And there are other contributing environmental factors. But in terms of knowing the cause, like the way you'll say, malaria is caused by this. And we give you this treatment and you're treated. For PCOS, we don't know the cause. Yes.
It happens.
It happens, yes.
Poleni sana. It happens. But ask your gyno. Your gyno will let you know.
And just to mention, there are many women with PCOS, but they don't have any symptoms.
Yes.
They have their periods, they're getting pregnant, and they're moving on with their life. And they have PCOS.
Yes.
Then you have women with PCOS who cannot get pregnant.
Oh, yes.
They can't conceive. Those are the most common ones that we meet.
Yeah.
Then we have the other common symptom that we see and will make women worried is that they don't get regular periods. And their periods are prolonged.
Oh, yes.
They stay for like 3 months, 4 months, 6 months, and they don't get their periods.
Yes.
So they get worried and they come to us.
Yeah.
And more so if you find young girls, when they share with the other girls, they're told, me, I get my periods every month. So why are you not getting your periods every month? Yes.
And it's not that they are pregnant, but the periods
periods just disappear.
And can it happen that whereby it can disappear, like maybe probably like a lifetime or something of that?
For PCOS, rare. It can disappear for long, 6 months, longest maybe a year, but rarely do you have that you don't get your periods throughout.
Oh, yes.
Yes. Because the hormone levels are still there.
Oh, yeah.
So you'll still be getting your periods. Yes.
So it is very, very important. Ask your gyno, because you can be getting your periods very well, but you do not know that you have PCOS and it's growing because it's in you and you might fail to know. So it is good to ask your gyno. That is why we are here for you. Ask your gyno. So next, Daktari, because at least, are there any type of nutrition that probably a person needs to avoid or needs to intake, to have a larger intake of it once they are diagnosed with PCOS?
Now, in terms of diet, that is like the medicine of everything.
Oh, yes.
Including diabetes, hypertension, PCOS. So for PCOS, we advise, first of all, a balanced diet.
Yes.
Then you avoid carbohydrate and sugary foods. Avoid, which is also what we tell you, diabetes, hypertension.
Oh, yes.
Yes. Try and take a lot of whole grains, vegetables, and fruits.
Yeah.
Those are the ones that we mainly advise. And of course, if your BMI is high, meaning if you're obese, you reduce your weight by doing exercises and also controlling what you feed. Okay. But what we shall advise is each individual has their own dietary requirements.
That's true.
So you come, we incorporate the gynecologist and the nutritionist, then we'll advise you on the best diet for you. Yes.
That is great. Again, ask your gyno. Because at least you've tackled in. Because I had one that was saying, why do I have so much facial hair? But you've tackled it. You've explained why. There are women who will get the facial hair, those who will get the acne.
Yes.
So different things.
It's mainly because of the hormone androgen. You know, men get the hair, a lot of hair.
Yes.
Because of the androgen, testosterone hormone.
Yes.
So you'll find in women, the testosterone level could be high, not necessarily as high as for male, but it's slightly high. So they get symptoms that will give them the hair growth and also the acne. Yes. Okay. And it's the reason also why the periods delay or they take long before they come.
Yes. I get it now. And how can I support somebody who has PCOS? Now they've been diagnosed with PCOS. How am I to support them?
If you're the partner, we shall advise every visit, come with your partner.
Okay.
So that they understand in detail what your partner is going through.
Yeah.
In terms of the diagnosis, the treatment, and the journey of PCOS. Yeah. Because PCOS is not something you come, we treat, and we say, now you're good to go. No. It's let me give you an example. If you're treating a couple with fertility issues,
okay,
we'll prefer both of you to come so that you go through this journey together. Rather than just having the woman come, then they go explain. Maybe the man does not understand.
That's true.
Yes. So the first thing we advise is come with your partner so that you understand what they are going through. Yes.
That is nice. So for those who are thinking on how to support them, work with your partner. it is the best decision because you will understand what the doctor has to explain to your partner and also how to tackle it in both emotionally, physically, and also medically. So work with your partner. Thank you for that. Then we can also have you can still get the regular periods you've mentioned.
Yes.
You can still get regular periods. And can somebody who's been diagnosed with PCOS, can they take the birth control? Is it advisable for them?
You mean the birth control pills?
Yes.
Now, we prefer not to call them birth control pills when you're treating PCOS.
Yeah.
Because when you say birth control pills, it means you're controlling not to get pregnant. Yes. Now, PCOS is mainly hormonal. There's a big factor in terms of the hormones.
Yeah.
So what the pills do, the hormonal pills, they try to balance the hormones. So the pills will give you a predictable menstrual cycle.
Okay.
Because you'll find most pills you take for 21 days, then you stop for 7 days, then you take for another 21 days.
Yeah.
So the 7 days you're not taking the pills, we expect your periods to come.
Yes.
Now, when you're treating PCOS, because there's no one drug you give and you say this one has treated PCOS. So we treat the symptoms.
Okay.
So if your problem is facial hair, that's what we treat. If your problem is maybe the weight, the BMI is high, that is what we advise you reduce. If the problem is the periods, you miss your periods for 3 months, for 6 months. And by the way, there are women who are very happy not to get their periods. So those ones you don't treat the period issue.
Yeah.
But there are some who will want their period to be regular as they plan to conceive.
Oh, yes.
Or to get pregnant. And there are women who will come and their main problem is getting pregnant. Missing their periods was not an issue.
Yeah.
Now, when they come with the issue of getting pregnant, that's when you discover that they have PCOS. So first you have to regularize their periods.
Okay.
Then you help them get pregnant.
Yeah.
Yes. That's how you treat. It's not a one-off treatment that my PCOS, I was given this one drug and it resolved. So hata huyu jirani wacha nipatie enda chemist tununue. No, it has to be tailored to the individual.
Yeah, because different individuals
they have different symptoms.
Yes. And can people still ovulate even as they have their PCOS?
Yes.
Okay.
Now, if your periods delay for 2 to 3 months, most probably you're not ovulating.
Oh.
Yes. If you're ovulating consistently, we'll expect your periods to come each and every month. So if you take 2 to 3 months to get your periods, there's a possibility you're not ovulating. And that's why most people who have PCOS, they have an issue with conceiving.
Oh, yeah.
Yes. But there are some who will conceive because you'll stay for a year. Maybe the first 6 months you've not ovulated, the 7th month you ovulate.
Yeah.
And you get pregnant. So not all of them don't conceive.
Yeah.
Most of them actually
they do conceive.
Yes.
Thank you so much, Daktari. You're shedding light into what we thought was probably something ya kawaida tu.
Yes.
As jakuja, I'm not ovulating. No, because there is that pain of ovulating and period pain. So if you're not getting it, the better.
Yes.
So ukiangalia haiko and I'm not pregnant, I know I'm not pregnant. So the better for me.
The better for me. I'm not buying.
I'm not buying it. Oh my. But it is good. It is good to shed light so that we understand that you need to ask your gyno. Anything, whatever you experience and you feel like this is not the normal way, because the normal lady should be ovulating and having their periods monthly.
Every month.
Yeah. So if you're not, please ask your gyno. It is very, very important. You never know. Asante sana, Daktari, on the issue of PCOS. And also probably I would love to also engage about discharge, the vaginal discharge.
Still on the PCOS, huh?
Still
maybe as we summarize.
Yes.
What we shall advise for PCOS, the first treatment or the first management is not even the drugs. We shall advise the first 3 months, you reduce your weight by almost 10% or more. Just managing your weight and your diet will treat 30% of the symptoms of PCOS. Yes, even without any drugs.
Mm-hmm.
So if you're not willing to, for pills, you have to take every day.
Yes.
So there's what we call the pill burden.
That's true.
So if you do diet and exercise and control your weight within the first 3 months, it can even normalize your periods without any treatment. Now, sometimes we have a problem with how urgent the matter is.
Yeah.
So if someone has not conceived for a year and they come, then you tell them, let's wait another 6 months.
Yeah.
Yes, there's the patient bit. So if someone is not patient enough to wait longer, now we initiate the drugs almost immediately. But the best is control your weight, the diet, exercise, then now the drugs come in to supplement that. It's like, I use the example of PCOS with diabetes and hypertension.
Oh, yes.
Yes. If you take the drugs only, but you're not controlling your diet, you're not controlling your lifestyle, then you're not managing 50% of the condition.
That's true.
Yes.
And should I just come ask your gyno, or nimefika nimekwambia daktari, I just want a scan of my reproductive system. Yes. I just want to know everything is okay.
Yes.
Because at times I might visit you. I probably, and I'm praying I don't have any issue, but I just want to nieleze tu. I just want to make sure everything is okay.
Everything is normal.
You do that.
We do that. And we advise. And there are some women who will even call you. Daktari, nimefanya picha, naweza kuja unione.
Yeah.
Any woman with any concern, they should come. In fact, we usually get excited when we just get a lady who doesn't have any symptoms.
Yeah.
They've just come to check if their reproductive system is okay.
That is nice.
Yes. We call them, those are gynecological follow-ups we do. Yes. And we usually advise every year or every 2 years if you're okay. At least
do.
Yes.
Very important.
Very, very important.
Young ladies, not just young, any woman out there, please, please, please ask your gyno. Just go do a random visit to them. You never know. Again, ask your gyno.
The gyno is here.
The gyno is here. Nambari mutaziona hapo tu. Namba zetu ziko hapo. Our social media platforms. Utapatana na daktari.
Yes.
Ask him. He's here. He will help you.